All right, thanks, Brett. Afternoon, everyone. Thanks for taking time to hop on our update call. Like usual, we'll go ahead and start with a review of the data. So Jordan, if you're ready, go ahead.
All right, sounds good. Thought I shared my screen, but it's not looking like that worked. Okay, so we're looking at the MySafeStart data, and you can see from our coloring that our counties are all classified as either low or in the A or B levels, with daily cases per million and percent positivity still decreasing overall. Our daily cases per million went from 16.5 to 12.6. And our percent positivity has decreased from 1.7% to 1.1%. Cases in the jurisdiction have decreased when we're looking at the past 2 weeks. They decreased by 11.5%. The cases we have seen within the past week have been identified as being household contact, worksite exposure, and pre-procedure testing. Our total number of jurisdiction-wide cases as of yesterday was 19,750, and cases by county as of yesterday are Crawford with 921, Kalkaska 1,066, Lake 593, Manistee 1,122, Mason 2,009, Mecosta 3,037, with Ferris reporting 741 cases, Misaki 1,269, Newaygo 4,555, Oceana 2,623, and Wexford 2,555. In the past week, we had 0 deaths reported to us, and 117 people are now considered recovered. Today, there are 0 COVID-19 inpatients in the 6 hospitals we report out on, and last Friday, now I can't see the date that it was, but last Friday we had 0 COVID-19 inpatients and 0 COVID cases. So that was a great sight to see. We're still not seeing any of the Delta variant in our jurisdiction, and an overwhelming majority, so more than 90% of our variants that we are seeing in our jurisdiction are the Alpha or B117 variant. So I'll switch to our vaccine table so you can take a look at that. As of yesterday, 61.8% of the state of Michigan had initiated their vaccine series. So our table is trending pretty much the same way, just slowly but steadily in the right direction. I'll just leave this up for a second and then switch to the initiation by age group and county and completed by age group and county tabs. Does anybody have any questions?
All right, thanks, Jordan. One of the things that you may notice off of those, especially off the completion, is we did Newaygo County moved up to 40%. So that leaves Mecosta County as our one county that's down still in the third, although 38, the high 30s percent wise for completion of vaccination. So we are continuing to, try to create opportunities there to allow individuals to get vaccinated. We are continuing with our pop-up clinics. Just to give you an idea, this week, some of these have already happened, and some of these will happen today and tomorrow, and then on Saturday. But on Monday, we did a clinic up in Kalkaska at the farmers market. On Wednesday, the 30th, we had a clinic again in Kalkaska at a meal site in Rapid City. Kelvin Norba Dixon School in Manistee. We were at CMH in Mecosta, and then Pentwater Public Schools in Oceana County. Today, we do have a clinic in Newaygo County, Woody's Bar and Grill, and then Mason, we're at Live in the Plaza. Tomorrow, we have a clinic in Mecosta as part of a community yard sale. That's going to be out at Morley. And then we'll be in Lake County at the Luther Logging Days. And then on Saturday, we'll be in Manistee as part of doing clinic at the Forest Festival, and that'll be down on the beach area. So each week, we're probably averaging anywhere from 5 to 7, 5 to 8 pop-up clinics that we'll do. We are still continuing to, although this will be the last week where we'll have set days for COVID clinic. Starting next week, we're going to really kind of fold in our COVID clinics to our regular immunization clinic schedules. So those schedules are out on our website, and we are promoting those. Individuals who wish to get COVID, vaccination for COVID, you can register online if you want to get vaccinated. If you're looking for another type of vaccination, school vaccinations, etc., then you can contact Central Scheduling and get signed up for that. We are still taking walk-ins as part of our vaccination efforts for COVID vaccine. We do ask, though, that if it's not one of our clinic days and you want to walk in, that you just call ahead to make sure that we have some staff available that can vaccinate you, so that you don't make a wasted trip in there. But we are still doing walk-ins. Our regular immunization schedule is going to vary by day and by county. And there will be evening appointments still. I believe those will go till 6 o'clock. So if somebody works till 4:30, 5 o'clock, and they want to come through the health department to be immunized or vaccinated for COVID, they still can get that. They still can get that done. I believe on a news conference this morning, the governor had announced a sweepstakes type project. I have not heard any of the specifics associated with it, so it's really hard for me to say anything about that. I think I think the potential would be there to maybe entice a few more people to get vaccinated, but I don't know for sure. We'll kind of have to wait and see what's going to happen with that. Other than that, we do continue to, our case investigation and contact tracing. Our cases have been, staying on the lower side, which is good, as Jordan's data showed. We, overall cases are down. Our cases per million and test positivity numbers are both down. So those metrics that we watch are staying on the lower end. I think I just saw an email pop up that we had 5 new cases in the jurisdiction today. Is that right, Jordan?
That's right. 2 in Mecosta and 3 in Newaygo.
So again, still staying on the lower end. And so, knock on wood, hopefully we're going to be able to stay there. The big question, I think, for everybody is how what impact, if any, will those variants have? The variant that everyone's concerned about is that Delta variant. That's the one from India. And I think it's, we're kind of have to kind of watch and see what happens with that. We know it's in the United States. We know it's in Michigan. But we'll see, we'll be watching to see how much of an impact it may have on us here in our area. We have not seen any of that variant yet in our jurisdiction. So, we'll see, how long that may continue for. Other than that, from the health department's perspective, today was kind of what we had pegged as our return to normal operations day. So, we are having more staff back in our offices. We're providing, pretty much all of our services, which we've been doing all along, but on a more regular type basis now in all of our offices. As I said, we will continue with COVID vaccination clinics, but they will become part of our regular immunization clinics. If we do see that there's a need to increase opportunities, then we'll, consider setting up some additional days specifically for COVID. But as of right now, we believe that we can handle it in our existing clinics that we have. There was new guidance that the MDHHS had put out for schools the end of last week. Really nothing new in that, other than that guidance listed all of the potential mitigation strategies that schools can use. Again, there were no requirements that the schools have to utilize these or follow these. It really is guidance and recommendations for them. So we do continue to, to answer questions that our schools may have. And I'm sure in the fall, we anticipate starting up those weekly meetings again that Dr. Morris kind of led with all of our schools to answer questions and provide information out to the schools. So those will be starting again. At least we envision those starting again down the road. So other than that, I think that's all that I have for today. So I'll open it up. Any questions that you guys may have? If not, I guess the only other thing to ask, and Brett, correct me if I'm wrong, but this is the last meeting with this group, right, that we have scheduled?
Correct.
Okay. So what is the consensus of the group? Do you want to, do you want to continue these update calls like this? Do you want to continue, if you want to continue them, do you want to go to maybe once a month as an update? Or do you think that we've reached a point where there's not a need to continue these? From the health department's standpoint and perspective, it really doesn't matter to us. I mean, we're going to continue to do what it is that we're doing. Jordan will continue to compile her data, and we will have that. So it's not a big deal for us to provide an update in a real quick meeting type format like this. So what's the group's consensus? I know there's not a whole lot of people on, but those that are on, what would you prefer? Joel? Is
it possible just to send us Jordan's information once a week that, like she has been doing? And
Brett, you've got the group, right?
And dispense with the meetings unless we come to a time when we need them?
Yes, that can work. So Jordan can get me it, and then I just send it out to the attendee list.
Okay. Jordan, what day you think by Wednesday we'd have that?
Yeah, usually I do the My Safe Start data on Wednesday mornings, so Wednesday might be a good day to send it all out.
So like by Wednesday afternoon, towards the end of the day, we could make that available to the group if that's what you want to do.
That sounds good to me.
Okay. How about everybody else?
I think that would serve the needs of West Michigan Community Mental Health.
Okay.
This is Holly with Spectrum Health. I support that, and just knowing that, if things start to turn the other direction, then we have the availability to pull this meeting back together.
Okay. Anybody not like that idea? Maybe that's the easier way to go. I know nobody wants to have another meeting just to have a meeting, but all right. Sounds like the consensus is we end these meetings and we'll just email out the data on a weekly basis to you, probably like Wednesdays. All right. All right then. Last opportunity for questions, unless Jordan, you have anything else to share, or Brett, you have anything that you'd like to share?
Nothing for me.
I'm all good.
Okay. All right. It sounds like we're done, guys. Thanks again for taking time to hop on the call, and everybody have a great 4th of July holiday weekend. Stay safe out there, and be looking for our emails starting next week.
Thank you very much.
All right.
Thank you.